Maybe this is why we're down here. So thank you all for coming. I think this is an amazing turnout in late August when a large group of the bank is still on vacation. So this is a testament to the interest that there is in the topic and the interest to join the work of the various groups that is going on in agriculture, in nutrition, in poverty. So this is a brown bag that's organized by SecureNutrition in collaboration with GAIN. SecureNutrition, I suppose that many of you are familiar with that. That's one of our knowledge platforms at the bank, which are trying to bring together agriculture, food security and nutrition. A lot of the work that we do in the poverty family as well. I'm Christina Malmberg-Calvo and I'm the sector manager of the Poverty Reduction and Equity Department here at the bank. And GAIN, and we will hear more from our guests here about GAIN. GAIN is the Global Alliance for Improved Nutrition. I just mentioned that I come across GAIN in another context in terms of food fortification of flour, I think it was. Or it was something also about salt, I think, about iodine and salt. And so GAIN, of course, is working in partnership with USAID, and they are going to share with us today the work that they've done in collaboration with a researcher on Kenyan farming and feeding practices and the food that are consumed by these communities, with a particular focus on vulnerable populations like pregnant women and young children and infants, the first 3 years of life, basically. So I was given some really good talking points, but I would think that all of you here know more about this than I do, that there are more than 2 billion people that suffer from deficiencies in micronutrients, iron, zinc, vitamin A, and that this obviously has serious implication for health and survival. And it's clear that we know a lot, but that we're learning even more because there are a lot of knowledge gaps. And I think some of the work that we will hear about today is precisely an effort to fill in and close some of those existing knowledge gaps. So I will introduce our speakers as we go along. They are reporting back from work in eastern and western Kenya, and it's studies that consists of Focused Ethnographic Study, which is then using OptiFood, which is a linear programming analytical tool, which I was not familiar with. And that will then in turn shed light on a number of issues with regard to complementary food production and acquisition behaviors and feeding behaviors, and it gives us some insights to what can be strategies related to nutrition in infancy and early childhood for farming communities. So with no further ado, I'd like to introduce to you the lady to my left, who's Bonnie McClafferty, who is the Director of Agriculture and Nutrition at the Global Alliance for Improved Nutrition. And so welcome, Bonnie, and then we'll introduce your colleagues as we go along.
Great. Thank you so much, Christina. Hello, everyone, colleagues. Some new faces, some old faces. Some of you have been very familiar with this work. We're delighted to present it. Today we are actually doing a road show. We presented this information to USAID, and I do want to say that I'm going to take a minute just to describe GAIN for those who don't know GAIN, and then I'll talk a little bit about the project itself, but I'm just a prelude to the researchers themselves. So this project itself has been funded by USAID as part of its Feed the Future initiative. GAIN was established about 10 years ago as probably the sole organization dedicated exclusively to nutrition. Nutrition sat There's a bit of WHO, there's a bit of FAO, there's of course here at the bank, but one dedicated organization that only focuses on nutrition. And 10 years ago, its mandate was to scale out large-scale food fortification. And over the last 10 years, it's developed other streams of work 2 of which focus on that 1,000 days, pregnant lactating women and children under 2, so products that feed the nutrient requirements of those communities. And only 2 years ago, no, maybe 2.5 now, they brought on agriculture, recognizing that the food system itself has a lot to contribute, dietary diversity is important, that the agricultural sector can either improve the nutrition of the diet or in some cases are actually reducing the nutritional quality of the diet. So let's take a look at that. But of course, in addition, that farmers are some of the most undernourished people in the world. So what can we do to reach those folks? So as part of this, perhaps a bit of a story to give the context of Kenya. When we first built the Ag Nutrition program at GAIN, we were asked to develop a tool, which I did present here at the World Bank actually a few months ago, which was to lay a nutrition lens on an agricultural value chain project. So the tool was designed to assist agricultural program designers be sensitive to nutrition as they built out their programs, everything from seed production through to consumption, through post-harvest loss. Are we considering the proper communities? Do we look at women as producers? What are the nutritional requirements? So how can we put a nutrition lens on ag programs? And in doing so, I presented those results in the tool to the Kenya mission. And I think a lot of you will probably understand the dilemma when you come to the missions of anywhere, or perhaps even here at the bank. On one side of the table were the agriculturalists, and on the other were the nutritionists. And the agriculturalists all said, this is great. We love that tool that can lay a nutrition lens on an ag value chain. This really helps us refine our programs. Stone silence on the nutrition side. And it's not that they didn't appreciate the tool, but their perspective, their paradigm is so different that they said, look, what can we do with this? We're worried about breastfeeding. We're worried about the 1,000 days. We're worried about, they have their own interventions that don't follow value chains or agricultural value chains whatsoever. So you saw the classic divide right there. But what they did say was, we're having a real problem understanding what moms are feeding their kids in these rural areas, and we know that complementary food is critical. And so we engaged in a large conversation that extended for a month or so, and I pulled Christine Hotz in immediately. And the real question became, we have to understand the behaviors of moms and what they're feeding kids, the choices, their barriers to obtaining nutritious foods into the diet of children. And we also need to understand the adequacy of the diet out there and what it can actually deliver, even in the most optimal circumstances. So that brought us to develop a project that's looking at using the linear program model called OptiFood, which Christine will explain how it's used. It's a linear program model that was developed by the London School of Hygiene and Tropical Medicine, along with Fanta. And that they have used that tool in Guatemala to look at some of the diets and how to optimize the use of local foods in the diets. And we then took that tool and applied it in Kenya, but then supplemented it with focused ethnographic studies to really get at, it's one thing to understand the gaps in the diet from the nutritious foods, but what are the barriers for the moms, even if you were to optimize that diet? Is it realistic to say eat 7 leafy greens a day? Is it realistic? Where is she going to source those foods? How is she going to prepare them? What does that do at the household level? And what does that do to costs and income and all kinds of other pressures that mothers are under and families are under, quite frankly? So this was all just a prelude to introduce my colleagues. And to my left, we have Christine Hotz. Christine will present the OptiFood work, some of the methodologies, the results, some of the recommendations coming out of this. Christine, I have known for many years. Christine was the lead nutritionist at Harvest Plus, so her knowledge of food systems and micronutrients in particular is extensive. And then we have Gretel Pelto. Gretel has a long and distinguished career. She is a graduate professor at Cornell University. And Gretel's work on focused ethnographic studies, GAIN has been involved with for some time. Gretel did some seminal work with us in the urban slums of Accra, as well as in Afghanistan, right? To look at the feeding behaviors and really help us, guide us in how to formulate foods to meet the needs and constraints of women in, I know the Ghana work. I'm not as familiar with Afghanistan. So I want to thank you both for coming. and doing the heavy lifting in this presentation. And thank you so much for giving us the opportunity to present this here.
We're delighted. Thank you very much, and thank you for inviting me to chair, because I'm learning. This is really important new area that I'm not so familiar with. So the game plan, is it that, Christine, how long will you be speaking? 15, 20 minutes? Or 15, 20 minutes? And after that, Gretel, you will go another? 15, 20? Okay, then we have to be very hard on the max 20 each. Because otherwise we don't have time for the interaction, and that's always so valuable as well. So please, Christine, the floor is yours.
Oh yeah, I can do that. Yeah, why don't I do that? I'll do that. Sorry. I have some context slides. So we'll jump right just so that we can give you folks as much time as we can. The goals of the study were to understand the opportunities to enrich the value chains of the base commodities that make up complementary foods in the what are called the Feed the Future zones of influence in Kenya. For those who are familiar with Feed the Future, in every country they've selected priority zones of influence where they will lay in lots of intervention, whether they be agriculture or nutrition, to have impact. But in the particular case, we want to determine the consumption profile of the infants in these target regions. We want to look at that gap between the current consumption of what infants are eating and how it may or may not be meeting biological requirements. We assess the potential for incorporating locally available nutritious food commodities into complementary foods and what they can contribute. I think that there's an understanding perhaps that local foods can produce everything, and if we just were to spend more time gathering more foods and drawing on the local resources, that would be adequate to the diet. I think that this unpacks that a bit for us. We particularly look at the 6 to 23-month-old range. And then we, of course, look at the opportunities, constraints, and costs of improving the diets through improved complementary foods in these priority regions. The two areas in Kenya, if I was at USAID and I said HR1, SA2, everybody would know what I was talking about. But in fact, they are Vihiga and Kitui. They're quite different. But they're both have a large rural poor population. And their stunting rates are quite high. Their nutritional, the nutrition statistics are quite appalling, and they happen to actually, well, at least in the case of the poverty density tends to be quite high as well. So those are just to provide the context of where we are in Kenya. Watch out for that cord.
Okay, thanks very much. Thanks for having us here, and thanks, Bonnie, for the introduction. I have to, let me just give you just very, very general overview of what this work has, this quantitative work has tried to accomplish in terms of outputs. We are trying to quantify the nutrient intakes among this target group of young children, and by doing that we're quantifying the adequacy of the intake of the specific nutrients, and most importantly determining what the gaps are. So what are the nutrients that we need to fill in so they can meet, children can meet their requirements. We combine the nutrient information with food intake information. So we're looking at the food sources of specific nutrients or specific foods or subgroups of foods. And we look at their intake patterns in terms of the portion size and the frequency with which they consume those foods. We put those two pieces of information together, and using this OptiFood system, we're able to come up with food-based recommendations. So these are sort of nutrient-driven food-based recommendations that are optimal for that population that will help fill any of the nutrient gaps. So in a nutshell, that's what we're trying to do here. I'll just say a little bit about OptiFood. I've never actually used it, so this is a disclaimer. It was mentioned Elaine Ferguson. She's a very close nutrition colleague of mine. She's sort of the mastermind behind this program. She's been using linear programming techniques for quite a number of years, running it off of Excel, and eventually, over time, she was able to really fashion it into this whole system with multiple stages and modules to accomplish this work. So she's been working, she's at London School of Hygiene and Tropical Medicine. She's been working with Fanta, World Health Organization, and the software developing company Blue Infinity to develop this software. It's meant to be, relatively user-friendly, still requires some training, some knowledge of how to interpret nutrition data, but that program is to be publicly accessible. It can be downloaded and used more widely by others. It has, just very quickly, it does have several different modules. Each module has a different purpose. We're trying to identify what the problem nutrients are. We're trying to come up with these very specific food-based recommendations. And it also has a module that looks at costs, so the market cost of different foods. It tries to minimize costs for foods that are nutritionally more adequate. So just about the field study, Bonnie mentioned we're focused on children 6 to 23 months of age in these 2 districts. We used a 24-hour recall method to assess dietary intake, so very standard methodology that I won't say too much about here. We did not measure breast milk intake, so all of the children we're working with and presenting data for are breastfed children right through to 23 months of age. So we did have to make some assumptions about breast milk intakes, which are probably fairly safe. And just to say, to assess the adequacy of nutrient intakes, we use the FAO-WHO sort of reference intakes as our reference point for what's adequate and what's not adequate. So just showing a little bit of the sample sizes. In this age range, we always divide children from 6 to 8 months, 9 to 11 months, and 12 to 23 months as individual age groups. They're changing very rapidly. Their requirements are generally increasing over that time, and as well the breast milk intake is declining over that time. So that's why we use very small sort of age groupings here and tried to represent each of those in the sample. Very quickly, a little bit about that population. Bonnie sort of described those areas in general, but indeed most of the households in those areas, they were landowners, albeit the pieces of land that they owned were very small, generally less than 1 acre. The vast majority were considered low-income households, so they are restricted there, accessing water mostly from rivers or else other communal sources of water, and very little income coming from the agricultural production on their land. So what they're producing is more, for subsistence. Just a very quick picture on, what are the foods that children are eating. Well, it's largely a maize-based diet. So down at the bottom, I'm just showing the percent of children who consumed these food items or these dishes during the 24-hour recall collection period. Big focus on, the maize-based porridges, the stiff porridges that are consumed with meals. A little bit of it's complemented by rice. As the sort of complementary or secondary foods eaten with those staples are some vegetables or even just the broth coming from cooked vegetables. And there is milk produced and used in these communities. In one, it was cow's milk in Vihiga. In Kitui, it was goat milk. So that's a quick picture of what they're consuming. We use this indicator of dietary diversity to describe the dietary diversity and the likelihood of meeting an adequate diet in terms of nutrients. And here we're just showing the percent of children across the whole age range who have received that sort of minimum, what's considered the minimum adequate dietary diversity of at least four different food groups. So we see in Vihiga, although they're getting up to 60% of the children who are meeting that minimum, there's still 40, 50, up to 60% of children who are not meeting that minimum. So very low diversity diets. In Kitui, in red, majority of children are not meeting that minimum amount. So low dietary diversity is probably a bit of an issue, something that can be improved upon. And I'm also reminded by this slide that we did do the data collection, dietary data collection, in only one season in each of these areas. In Vihiga, in pink, that was a little bit more in a more food plentiful season, and in Kitui it was a little bit more of a food restricted season. So they're not equal, and that accounts for a little bit of the difference between those two areas. But still, diversity is an issue. So now I'm going to move to the nutrients, specific nutrients, and give you a sense of the adequacy, which nutrients are problematic or less problematic. I'm expressing this here as the percent desired nutrient density. This is for children 6 to 8 months of age. So this is really about the amount of nutrient per kilocalories, so per energy unit. And we're looking at the adequacy of that. So it's just another way to express it, adequacy for these younger age groups. So the reference would be 100%. We want their diets to contain 100% of the desired nutrient density. So we have a little bit of a pattern that emerges. For the first nutrients, the minerals, calcium, iron, and zinc, the adequacy is very, very low. For vitamin A and vitamin C in one location, it was adequate. There seemed to have enough vitamin A and Vihiga vitamin C in their diets. And then the rest are the B vitamins, and those are kind of middle of the road. Some will be meeting their adequacy, some not, but they're sort of moderately inadequate in the diet. These are the same data for the 9 to 11-month-old age group, largely the same pattern. Some of the B vitamins are just coming up a little bit. And the same data again for the older age group, the 12 to 23 months. Calcium, iron to some extent, or lesser extent, zinc remain low. Vitamin A and C a little more adequate, and the B vitamins kind of middle of the road. Okay, now, so that's what children are eating. That's their sort of current diets. Now we move into the modeling part of what OptiFoods does. And so here we're trying to identify the problem nutrients. The program has modeled what we call the best possible diet. So it's taking the parameters of the actual diet of the children, the foods that are available and consumed by at least some of the individuals in the communities. It's looking at up to the maximum frequency, so children who consume, a particular food the most often or with greatest frequency. That's used as sort of an upper boundary, and with portion sizes as well. So we're taking those parameters and trying to say, within the bounds of what anybody could consume or is consuming in those communities, what's the best possible diet in terms of meeting your nutrient requirements. So that's done, and what this slide is showing are the nutrients that cannot be met, even with that best possible sort of maxed out dietary scenario for these populations. In Vihiga, you cannot meet the requirements for calcium, iron, and zinc in any age group. And in Kitui, it's iron, zinc, with the addition of vitamin B12 in the older age group. So these are our problem nutrients. And effectively, we can say, to correct these nutrients, we can't just say, change your diet, because they don't have those foods available. They're not accessing them in sufficient quantity at this time. We need perhaps an external solution for them to be able to acquire sufficient amounts of those problem nutrients. The last part of the modeling, well, it's a combination of things, but so this is where we take those diets and we say, okay, what are the food sources of nutrients? What are the foods that the model, the programming is picking out to say, if you want to meet your more of your nutrient requirements, these are the foods that are going to help you get there. And so we're picking out some of those foods. We have green leafy vegetables, dairy, fortified cereals, and millet. It's telling us how frequently those foods would need to be consumed on a weekly basis. So for example, 7 servings of green leafy vegetables, that's 7 servings in a week, so roughly once per day throughout the week. 21 servings of dairy would be 3 times a day, every day of the week, and so on. So what this is showing, if we did not have any, did not implement any of those dietary recommendations, they would, this is an example for children 6 to 8 months of age in Kitui. It's just one example. If there were no recommendations, they're meeting their nutrient requirements for only 1 of the 11 nutrients. And then for our 2 main problem nutrients, iron and zinc, they're only getting 5% of the requirement and 18% of the requirement for zinc. The cost is 4.6 Kenyan shillings per day. That's that best possible diet, the maxed out one. They would meet the requirements for 9 nutrients. And as we know, they still won't meet their requirements for iron and zinc. So this is what would happen if we added 1. This is the single sort of best food-based recommendation that was picked out by the model. It's not, exclusive in any way. We're just showing sort of the top one that comes out, which minimizes the cost. So if we did add in the 7 servings of green leafy vegetables per week, they would cover 4 of their nutrient requirements, the requirements of 4 of those nutrients, and bring up the iron and zinc slightly. If we took that first recommendation and added the 21 servings of dairy, they would then be meeting requirements for 8 of the nutrients, bring up very slightly the iron and zinc adequacy. If we took the first 2 and then added 7 servings of fortified cereals, again they'd be meeting 8 of the nutrient requirements, bring up the iron and zinc a little more. Increment in cost is a little bit more. And then the final one, if we took those 3 and added millet in, they'd be meeting 9 of the 11 nutrient requirements. And again, just getting a little more iron and zinc, but still not enough. I can just, you can see the relative cost difference between the no recommendations and the best possible diet. It's sort of a, 4 to 5 times more costly. So I'm just showing you the figures. If that's realistic or achievable or not is, that's part of the next phase. We can package those up and say, okay, based on that theoretical maximizing or optimizing the nutrient intake adequacy from that diet, these might be a set of food-based recommendations. Breastfeed on demand, that's sort of a given. Feed legumes, meat, fish, or eggs every day could be another one. The green leafy vegetables every day. Feed a fortified cereal every day. Feed millet flour at least 7 times per week. Feed dairy products at least 3 times per day. And you might want to add that to some of the porridges. So these, in some ways you might say, well, these are just the standard food-based recommendations that we find in textbooks, just very cut and paste, but something like millet flour, that's not one of the cut and paste, textbook recommendations. That's actually very specific for this community, and it's, based on the fact that they have millet available and it happens to be rich in iron and zinc. So it is, and the frequency and so on is actually, tailored a little bit to these populations. I had given, those examples for on the previous slide for the 6 to 8 month old age group. When we do, run the same models for the older age group, 9 to 11, you can actually come up with, the same sets of recommendations would apply. So there is a goal, we can't have very, very age-specific recommendations, and for this age you do that, and that age you do something else. So there is, sort of an attempt to have one set of recommendations that would be, applicable and effective for across those age groups. So those recommendations are purely nutrient-driven. It's theoretical. There's the whole practical side and what's going to be feasible, what's going to be doable, manageable, affordable, etc. Those are other questions. Gretel will be addressing some of the constraints around possibly being able to implement some types of recommendations. So this is really just the first step in what is meant to be an iterative process. We've come up with some foods that would fill the real, nutrient gaps. Now we have to take a look at the other side, what might be feasible. We can work, with agriculture, for example, perhaps with food industry, developing novel products, and we can then put those types of things back into the model and see, how adequacies might change. If we introduced, for example, a fortified complementary food product, we could use this modeling to help inform on the amounts or types of nutrients that might be put into that fortified food product. If that were introduced, maybe that would mean some of the other food-based recommendations would no longer be necessary. So it's quite an iterative process. You can remodel, you can use it to help design other types of interventions and retest them. So this is, it is evidence-based, and we believe it could be used then to support advocacy for certain types of recommendations or interventions. Finally, I just want to come back to the issue of those, the problem nutrients I mentioned, the iron, zinc, and in some cases calcium and vitamin B12. I was saying that those may require external solutions. They would require external solutions. We need external sources of those nutrients. So what kinds of things are we talking about? That would be perhaps more focused on markets or nutrition-based programs, introducing new food items through market change. We had one example of small dried fish, for example, that was not consumed in one of the areas or just by a few children. It seems not to be available in those communities. Doesn't mean they wouldn't eat it if it wasn't in the community, but they're not consuming it, or very few people are consuming small dried fish. One could explore the possibility for implementing sort of developing a food value chain for that particular food commodity. So that's getting, they're not novel or processed foods necessarily, but getting nutrient-rich foods into a market where they currently don't exist. Introducing fortified complementary foods, I mentioned, so that would be more private sector driven, and perhaps the need for complementing, filling those problem nutrients with something like the micronutrient powders. For the internal solutions, that could be a little more behavior change focused. We did find, of course, like with many of the B vitamins, that you could meet those requirements by adjusting the food intakes, maybe eating a little bit more of some foods and replacing those with other more nutrient-dense foods. You can cover several of the nutrient gaps by doing that. So that might mean promoting increased frequency, of intakes of those specific foods, perhaps promoting specific recipes that incorporate those foods. That may then require promotion of increased production locally, agricultural production. If so, how much more do we need in the system? And reinforcing some of the good practices. Some people are meeting those nutrient requirements, so you can, reinforce those types of practices and see if more people can sustain them as well. Bring you to Gretel then, to go from the theoretical to a reality.
Okay, taking up where we've left off. I want to discuss results and implications of the Focused Ethnographic Studies in Eastern and Western Kenya that we completed this year. I would love to spend a whole hour telling you about this exciting methodology, but that's not the point of the session today. So I'm just going to race through and give you a very, very brief overview. The FES uses a mixed methods approach to study feeding patterns and practices in children 6 to 23 months. The framework that it's theoretically grounded in cultural ecological theory, which has been around for 40, 50 years, at least in anthropology, and it is designed to obtain data on 6 sectors of determinants of IYC. And from here on, instead of saying infants and young children, I'm just going to say IYC and let you fill it in. We know a lot about the determinants of IYC nutrition in general. This takes it into 6 sectors: diet, the physical environment, the social environment, technology, socioeconomic organization, and culture, defined as beliefs, knowledge, values, and motivations. And the basic intellectual foundation for these 6 areas is very well established in nutritional epidemiology. The methodology uses very small samples of 40 to 45 per site, which are heavily selected on both FES and child age, and intensively interviewed with 8 modules. The modules are interconnected, and they're built from an initial 24-hour dietary recall, as well as the usual IYC foods, as reported by caregivers. And what I mean by built on it is you start with a 24-hour recall, then we look at how the foods are sourced in relation to those foods, and how they're prepared in relation to those foods. So we explore step by step to get ultimately through all of these 6 areas. There's quantitative analysis and text analysis of themes in caregiver narratives, which are responses to open-ended questions. The key to the FES is that we try to the fullest extent possible to avoid imposing our models and our understandings about how to ask the questions. So the questions are asked very broadly, and the data then are abstracted from these pages and pages and pages of narratives that emerge. Okay, before we get into, well, this is the first data slide. We want to introduce a concept which has been widely used in nutrition for decades, of core foods. And I'm sure most of you are familiar with the basic concept of core foods. To the best of our knowledge, nobody yet has talked about IYC core foods. And by that, we really mean the existence or lack thereof of the special complementary foods that are designed specifically for IYC. And we want to know, does this concept exist? What are the foods that mothers, caregivers are saying are important? So it turns out that in both Vihiga and Kitwe, there are very clear concepts about the foods that you feed IYC. And the first round of core foods are porridges, preferably millet or mixed grain, only with maize as a fallback position. These next 2 will probably come as a surprise to some of you. Rice and Irish potatoes are right up there with 100% of the mothers saying, that's what you should feed, that's what I would like to feed my little ones. Green bananas. Then in Vihiga, which is a tea-producing area, tea with milk and sugar. And in Kitwe, the milk without the tea, or with very, very little bit. The secondary core foods for IYC are the core foods for the culture, are the core foods for the family, the things that everybody is eating, with very clear parallels between the 2 sites. I want to just make one brief pass at some of the positive cultural findings. There's lots more, but these, I think, are some of the most important. Many caregivers demonstrated solid nutrition knowledge. The Kenyan public health system, the NGOs who have been working there are making an enormous difference. I couldn't believe it when I saw the level of nutrition concern and nutrition knowledge that many of these women were expressing. I would have been proud of some of those statements from my undergraduates. Very importantly, the caregivers understand the relationship of food quality, not just quantity, but quality, to child survival and growth. And they are, in general, deeply committed to providing their IYC with the best foods that they can afford. And they place a very, very high priority on infant feeding. Another positive cultural finding, extended family and neighbors help families with IYC to acquire food when food and financial resources are scarce. The rest of the story now is going to be a lot about food scarcity. There are three problems for infant and young child feeding that I want to highlight this morning, and these problems are divided into problems related to home food production, problems related to the acquisition of non-home produced foods, problems related to food preparation. Each of these being areas where there's multidisciplinary collaboration, where we start to make the links between agriculture and nutrition. So, first, problems related to home food production. Number one, lack of water. Number two, lack of water. Number three, lack of water. Lack of water is the primary message these caregivers wanted to talk about and tell us about. Not just in the dry season, all year round there are water problems. Secondly, surprisingly, difficulty in growing millet. And millet is an arid area crop. They should not be having problems growing millet, but they are. The mothers are, many of them saying, I'm giving up. I try year after year. I can't get enough of a crop to make it worth the effort that's putting in. That's an agronomy question. Somebody needs to get out there and figure out what's going wrong in these, and it's in both areas, why the women are saying they can't make these crops work. Thirdly, and obviously, vegetables which are growing in the shamba are only available seasonally. Once the shamba starts producing, those vegetables essentially disappear from diets. Animal source foods, all of you in the bank know that livestock is your insurance, livestock is your bank account. You don't kill animals for food. There are also issues around milk and milk production, which I'll come back to. And number five, women without male partners or who are ill are seriously disadvantaged. I'm going to come back to this point over and over, but I want to make the point it's women without male partners. Many women do have male partners. Many women have the kind of support and help they need from their partners. Women without male partners are seriously disadvantaged with respect to home food production. And other things, as we'll see in a moment. Problems related to non-home produced foods. Most IYC core foods are purchased. The heavy reliance on purchased food leads to the need for cash income. There is a critical lack of local income earning and income generating opportunities for these women. Also, access to affordable purchased foods are constrained by multiple factors, including their relationships to sellers, the distance, because credit, the ability to get credit is more important than the price they're paying, distance to market, family compositions. There are a number of things that affect access to these purchased foods. Problems with home preparation. There's a heavy exclusive reliance, actually, on salvaged firewood for fuel. Big problem coming up in the future. That salvaged firewood is going to run out one of these years, and then what? For the moment, though, the major problems with salvaged firewood have to do with the effects on home preparation. Water shortage, again, is a major issue in terms of how women manage home preparation. Time demands, firewood and water collection, travel to food purchase places, income activities, all of these reduce the frequency of cooking. Remember, this slide is about home preparation. The need to save firewood and time leads to unsafe food storage practices. You cook in the morning, so you don't have to start a fire again, so you don't have to spend time cooking again, and then the food sits there all day, 8, 10, 12, 14 hours. We did not do the bacteriological studies to demonstrate that there's a food safety problem. This is another issue that needs more research. It is probable that there is, because when that food is sitting there in a warm environment, and it's often is pretty high protein foods, it's likely that the food is carrying pathogens. Lack of refrigeration obviously also contributes to food safety problems. Now I want to look at food insecurity and seasonality. In some households, food insecurity is pervasive throughout the year. In many households, food insecurity is seasonal, and very few households are food secure throughout the year. These are typical of the kinds of narratives that women gave us in response to the seasonality and food insecurity. And they reflect three different directions or kinds of problems. The first one highlights the psychological consequences and the psychological burden of food insecurity. The second one reminds us that women have needs for cash and for income that go beyond food. They have to buy clothes to send their children to school. They have to have money for medical care. Food is competing with other costs, and even with other cash needs. The third is to highlight that the lack of food and the adaptations that women make to that have consequences for the women themselves. And that's how they see it. I mean, over and over again, the point is, how do the women see it? What are the stories they're trying to tell us? Women are not passive in the face of food insecurity. In fact, they have a lot of strategies, and there are income-earning strategies, including short-term activities to earn money locally from neighbors, gathering firewood, carrying water, helping in the fields, or traveling to population centers to find casual labor. They do sell farm produce and milk seasonally. In Eastern Province, which is a Kamba area, there's a little bit of craft going on for selling in the big markets. But the Kamba, who 30 years ago were world-renowned for the quality of their basketry, are doing almost nothing now. There are just a few women who are still doing that. Also in the Eastern Province, there are some opportunities for participating in Food for Work or informally organized work groups. We didn't find any evidence of women doing that in Vihiga. There are a small number of women who are small-scale entrepreneurs and who earn money that way. There are non-income strategies for food insecurity, receiving money from husbands and fathers to purchase food. Many partners or men who've gone away are deeply concerned about supporting their family and bringing them back money, but there are some men who are not. And there are enough men who are not that this is a major problem for many women. Receiving credit from local stores to buy food is another strategy. Borrowing food or money from relatives and friends is very, very important. These are very tight social networks. And people help each other out until they can't anymore. And we have some heart-wrenching stories of women who are saying, you know, my mother said, I can't give you any more. We don't have anything to eat either. I'm sorry. Foraging and hunting. And then, to a very small degree, social welfare programs, which are, again, more evident in the Eastern Province than in the West. Nutritional consequences of food insecurity. A significant finding of the study is the magnitude of negative changes in IYC diet that occurred during the periods of greatest food insecurity. and those important sources of nutrients that Christine was highlighting, many of those are gone during the period of strong food insecurity. And although caregivers and other adult household members buffer infants and children when food is scarce, the buffering does not compensate for the loss in diet quality and quantity that caregivers report is necessary during the dry season. I want to summarize the situation with women, caregiving, and household economic management, and then I'll close with 3 more slides. Women have major responsibilities in food production for their households. They have major responsibilities for earning the cash to provide their children with the purchased foods. They are responsible for ensuring that water and firewood are available for the households. They face severe constraints on their child care time because of these competing demands. Women without partners or supportive partners have particular difficulty balancing these competing demands. And ill health in a woman or in key members of their support network constitute a crisis situation. Now, my 3 slides. I want to stress that I call these are high priority and priority issues from my reading of the results. I'm a nutritional anthropologist by training. I'm influenced by the lens that I bring to it. I hope that within the next few weeks, these large reports, I warn you, they're 130 to 150 pages, will be available through GAIN as discussion papers. And I really encourage you to at least skim them, because I know if you're coming from a different background, from economics, from agricultural development, you will see different things and see things that I don't see. So these are my personal priority issues. Water. Something has got to be done about water. Millet. Something needs to be done about millet. Safer food storage, I believe, is likely to be something needs to be done about it. Local animal milk production is a very complex picture. We don't really understand it very well. Women are selling milk and then not giving it to their kids. They're giving it to their kids and foregoing buying other things. The whole milk production just needs more thorough investigation. Other IYC food priority issues from the FES. The need to improve access to affordable, nutritious, core complementary foods is very high, including developing and introducing new fortified complementary foods, improving the availability of vegetables after seasonal production ends, potentially promoting dried fish in Eastern Province where there don't seem to be any serious food taboos that one has to overcome. They're just, as the Kamba say, not part of our diet. And they're not available, but people might use them. And in Western Province, kids are getting dried fish from a very, very early age, very early age. I also think there needs to be further investigation of tea intake in Western Province and whether the amount of tea that kids are getting is actually interfering with nutrition. And finally, another set of non-priority issues, targeted economic and food support for families with children 6 to 23 months, with the development of systems to support purchase in periods of food insecurity. This really needs to be done, and it needs to be done now. Increased income-generating opportunities for women is really high on the list, and that means income-generating activities not to increase the amount of time they're putting in, but to increase the return they're getting. You can imagine the pittance, what they get from collecting firewood and selling it to a neighbor who has a little bit more money. There have to be better ways for the use of their time on those income-earning activities. And then thirdly, and again, this now points in the direction of technology and technological alternatives, diversification of the cooking and fuel alternatives, because that is driving so much of the demands on women's time, and also the food safety and quality. So those 3 sets of suggestions are my suggestions, and as I said, I hope you really will look at these data and think about what they say to you, because it's the women who are speaking to you, and that was our whole point. Thank you.
Thank you very much, Christine and Bonnie. I would think to many of us, and certainly to me, this brought back so many memories. Many years ago, before I came to this place, I used to live in rural Tanzania, in the highlands, southwestern highlands. And I was working on a travel and transport program, and we were trying to map the transport patterns for rural households. And very quickly it became clear that it wasn't roads always justified or the massive amount of surplus product. People didn't have time to farm from massive surplus. They were very busy fetching water. They were incredibly busy fetching firewood. It was an enormous amount of time. In addition, of course, going to the shamba and cultivating, and then after we go to market to maybe buy catalytic change or so. But invariably, all the women we talked to, when they were ready, said, when we asked them, what would you do if somebody came and parked 3 buckets of water on your door, by your house every day, and you could save that time, what would you do with it? Almost all of them said, I would cook a better meal for my children. So they're very aware that they're not eating well, and they're not feeding their children well. And it was anything from where I would arrange my cooking stones differently, and or if they had more firewood, and so on and so forth. So it just brings back to me what an integrated affair life is. You know, it's farming, it's water, it's firewood, it's all the preventive care that they could take advantage of had they had the time to travel to the clinic to do it. But they don't have the time. So anyway, the floor is open. Please introduce yourselves. I know this is a very small club, probably, and you all know each other, but nonetheless, all of our presenters may not know you.
Hi. My name is Caroline Abla. I work with International Medical Corps. I just wanted to hear from both of you I didn't see the linkage between the best diet that is there that you found in the formula to the study that you found. Just to me, it said that even whatever we do or whatever they do, they're not going to be able to meet it unless we bring in things from the outside. Is that exactly what you're saying?
Yes, shall we collect a couple of questions, and then so the gentleman and then the lady?
John McDermott. I'm from IFPRI. I'm the director of the Agriculture for Nutrition and Health program in the CGIR. My question's to Greta. In the kind of surveys with households, did you get a sense about community organizations or health services or things that could be used to deliver some of your ideas? Were people accessing them? Did they have, I mean, you had kind of positive outcomes about health and nutrition information. Can we look at those kind of delivery systems and other types of community organizations? What do you see?
Yeah, my name is Alberta Nyaku. I work with PATH, the nutrition program in PATH. I really and Christina, thank you so much for such an enlightening presentation. I really appreciate the use of FES for collecting this data. It really goes, for me, it's actually giving us a more holistic approach to programming in nutrition. But I'm interested in the ease of use of this approach. How long did it take? And actually, I also wanted to ask the question asked by my colleague from IMC about how it was linked up with the recommendations for the nutrient-dense foods. How effectively was it linked up? Thank you.
Okay. Why don't we test some of the questions of these, and then we do a couple of more rounds.
Yeah, on the question of linking these two pieces together, I think that's kind of where we are right now. We have these two sort of bodies of research. We've spent a little bit of time talking and thinking about it, but what needs to come next is really, I think, a very thorough assessment of the opportunities. Gretel's mentioned some. We've kind of alluded to some potential ideas, but one, for example, was the issue of the millet. So this came up in our, quantitative nutrient-based modeling as a potential to help fill in the gaps that would be, probably very specifically for iron and zinc. So that's good. There's some millet there. We can talk about that. But then Gretel has found in her research that they're having problems growing the millet. Maybe they would grow more, probably at low or negligible additional cost if they could just use that same piece of land and get more out of it, actually get the millet to grow. So we have an agronomic problem that's been identified. So that would potentially require an agronomic solution. So that's one avenue that could be explored with agronomists to say, let's help solve this problem. Maybe that will feed that recommendation. We had this very interesting findings about the very strong nutrition knowledge that these women have. They have this practice, which is great, of preparing special foods just for the infant. Gretel mentioned the rice or the rice and potatoes, these special dishes. They're not cooked for the rest of the family, they're cooked for the infant. Can we sort of capitalize on that sort of knowledge, that practice, the knowledge that they need to produce special foods for the infant, and either through education and using available means, add additional nutritious ingredients to those foods? Can we enhance their nutritional content? Or if we had special complementary foods that were fortified, perhaps formulated to fill some of the nutrient gaps, that we can sort of capitalize on that practice to say, this is a fortified food that's special for your infant. You don't need to acquire it and feed it to the whole rest of the family necessarily. But so I think we need to look more closely at these data, put the pieces together, try to find the opportunities within some of the constraints. We've also, talked about requires exploration, but there's this restriction of, firewood and fuel. How would it be to introduce some, instant type foods where they could be prepared with clean water, but that could reduce the need. It might be something that they find, even if it cost a little more, would that save them enough time where they could use their time, for more productive, economically productive activities? So that, and these are the kinds of things I think that, the more people that could kind of look at this information and have different ideas or experiences about what might work or fit together, we could maybe get out of the box a little bit and try and put the constraints and the opportunities together.
I'd like to... Okay. At the risk of being a little bit offensive, and I apologize ahead of time, I think one of the things we learn from our research is our own mistakes and what we're doing wrong and where our assumptions are wrong. Bringing in food from the outside is a wrong assumption. Human societies have been delocalized with respect to their food systems for 300 years, 500 years, depends on which system you're talking about, it depends on where you look. We have a very powerful myth about the self-sufficient peasant. There are some, there are occasionally. But these families in Kitwe and Vihiga and pretty much everywhere else that I've ever lived or worked, are not self-sufficient farmers. They have been making use of markets since forever. And I think it is really disturbing to see that the core IYC foods, none of them are local. They would be, the millet porridge would be, if people could grow them. So the relationship between the household food supply and what children are being fed and the market is they're so interconnected that we need to turn our heads around. We need to pay attention. I really feel very strongly we need to pay attention to that. So let's drop the idea of bringing in food from the outside, and OptiFoods is going to go a long, long way to help us face that reality and to have some ammunition against the food Nazis who remain nameless at the moment, but we all know who they are. There is no food system on the face of this earth, if you take a small group of people, where people can meet all their nutrient requirements without going to the outside. Fortunately, we're living in a time when we do have some options and we can look at technologies. I don't want to talk more than I should, but I just have to share with you. This morning, we had a wonderful presentation from Fanta on the results of an OptiFood analysis in Guatemala, in the rural areas. Guess what food is so much part of the basic diet of women and children that it goes right along with tortillas and beans? Incaparina. Incaparina was a food that was created by INCAP 30 years ago, 40 years ago. I wish Nevin Scrimshaw was alive to have seen the presentation today. That food is part of the culture core. And it is an external food, if you want to talk about classic Mayan diets. So let's look at our assumptions and let's look at how we can get the nutrients that people need into the diets that they can afford. With respect to community organizations and healthcare, it's very clear that in the two places that we studied it, and in other places where we've done the FES, that in general, health services are seen as a place that families go for advice and for help and for support. And I think that there have been big improvements in the delivery of primary health care and through outreach. So I think that that structure of organizations is there. In Vihiga and Kitwe, we did not find formal community organizations playing the role that one might have expected. It's very much family-centered. So I would say, if that needs to be examined further, but I was a little surprised by those results.
Okay, thank you. Let's do another round, and then I will ask our speakers, they get 2 minutes each to wrap up. Yeah. So, you have a comeback on that?
No, my question wasn't answered at all.
Okay.
I was talking about, my question was on the ease of use of
Sorry,
the
absolutely, I'm sorry. We're working on it. We're working on streamlining it. We're working on creating a cadre of people who are trained on how to use it. It should take no more than 2 to 3 months. It should be affordable. When I worked for WHO, we honed our FES for acute respiratory infection to the point where I think it was administered in 34 countries, and it was definitely a program management tool. And then, very unfortunately, the donor community decided that programs that were directed to one disease was out. No more ARI programs, no more CDD programs. and no more FES for ARI or CDD. So it just died of death, and that's what happens. And no doubt this will also die a death, but we hope it won't die before we give it some more push. I think that these are feasible. I think they are economically feasible. And we all need, and we need all your help. We need everybody's help to get it going.
Thank you. Yes, please. Jose and...
Hi, I'm Ashley Akeson with PATH. I'm a fellow nutritional anthropologist, so I really like FES. A couple questions. Is there any plan to replicate this, or is anyone replicating a similar study in a country that has a national social insurance program? Because you mentioned the need for income and how income might even out seasonal availability. With all the time demands on the mothers, I'm wondering about how does that bleed over for older siblings, especially adolescent girls? Did you have any findings related to that? And do the mothers mention family planning at all in the context of, I wish I could not be having a child in the middle of this food insecurity? Thank you.
Thank you. Great questions.
Hi, I'm Jose Cuesta. I work for the World Bank. I'm an economist, so I have, everyone is saying here what they are, so I was an economist. I am saying this because my first comment is about the integration of the two approaches. As an economist, when I hear the word optimization, I think of maximization with constraints. But in the presentation, I haven't heard really much about constraints. And I think one simple way to integrate the two approaches is to get that rich information that you get from the ethnographic studies to try to bring that into the modeling, because you have information of time, you have information of cost, of preferences. I think that would be a nice way to retrofit the model and get a new sense of what are the restrictions they have with those, the results with those restrictions in the model. And I'm an economist, I'm also a man, so my question to you, Gretel, is what men think? Do they have the same sort of considerations, concerns? Do they have the same priorities that women report? I think that would be very interesting to contrast. Thank you.
Hi, good afternoon. My name is Liz Buckingham from the Office of Global Food Security at the State Department. A question that I've kind of been wrestling with this field is that deals with women's time and constraints with women's time, because I think that we want to encourage good care practices and good breastfeeding, but we also see one of the potential interventions to help with food insecurity and nutrition is income generation, activities, entrepreneurship, that type of thing. So I'm wondering if I kind of see a conflict there, because we want women to have time to be able to care, cook good food, breastfeed, but we also want to give them opportunities to get an income. So do we see a conflict there? Is it a bigger problem than it should be? How have you seen it addressed?
Hi, I'm Paul Robinson. I'm an independent consultant here. Thank you all for your wonderful presentation, a lot of learnings. Just a quick question. In your recommendations, have you thought about small animal farming? We are talking about millets and other sources of food, but as we look at the protein sources, is it feasible to have chicken or small rabbits being grown? In one project that I led in Kenya, and then did a case study there in rural Kenya, I found that they were income generation. They were actually farming and raising small rabbits in cages in a very sophisticated way. And that seemed to have taken on very well. So I was just curious about chicken, rabbits, other things that might be recommended as sources of proteins. Thank you.
Hello, I'm Avril Armstrong, and I currently work with Land O'Lakes International Development Division. Thank you, very interesting presentations. I wanted to ask about the OptiFoods. A simple question, is it similar to the cost of diet tool and that was developed by Save the Children? And also, did you consider wild foods, or were there wild foods available to be included in the analysis? related to the question about replicating the study, I was just thinking about generalizability. Will there be something in the recommendations that can be, that other regions, I think of northern arid lands, can we use, is there some information that can be used so we can, help move what we're doing forward in different regions of the world? Thank you.
Thank you. Let me add the lady.
Hi, I'm Marcia Griffiths from the Manoff Group, and this was really very interesting and great to hear more qualitative and quantitative work being done on infant and young child feeding. So I would like to follow on Alberta's question and Avril's question a little bit more about the methodology, and just ask you, I know Gretel certainly has worked for years on infant and young child feeding, and how does the OptiFood's methodology plus Focused Ethnographic Studies compare to the other methodologies that are out there, of which there are many, both for quantitative and qualitative work in this area? Pluses, minuses, right, improvements, etc.
Thank you very much. So I think what we'll do is that if you take now 3-4 minutes each, and that will also be our wrap-up. And then we will close the session that way, because I know every other person in here has a 2 p.m. or 2:15 p.m. Meeting. We don't want to lose you.
Why don't we just
so there were a couple of questions around the methodology and some of the constraints. Just to sort of reiterate, the constraints that we used in the model were set around the foods that were actually consumed. They can be restricted to either, for example, if at least 5% of the children consumed one food, then it can go into the modeling. We actually, for this purpose, relaxed that a little bit, and basically if any or 2 or 3 children consumed a particular food, it went into the model, so it could be picked by the model to optimize nutrient intakes. And the other boundaries were around the frequency, so we went up to the maximum frequency that any child had consumed a food in our recall system. So those were the constraints. And so if wild foods, to the wild food question, if wild foods were consumed, they would have been included. Again, we just did one season, so some of those wild foods may not be here. They may show up at other times. So, yeah, those are some of the limitations. Let's see. The small animal farming as an example, I mean, that's exactly, this is it. We have maybe some, a little more specific information on the recommendations, frequencies, and amounts for certain types of foods. That's one idea where, again, it could take the constraint of needing income-generating activities and tie that with producing, nutritious foods and getting them into the local food system. I think that's exactly it. And I think these two kinds of things have maybe sometimes been working in isolation. We have lots of small projects, looking at small livestock production, for example, someone else doing a dietary survey over here and saying, well, these are the recommendations, and, let someone figure out how to do that. So, I think this is really kind of the time where we say, we've got the quantitative, we've got the qualitative, we've got the constraints. Now we've got, all these other people working on novel ideas, briquettes for more efficient fuel use. Like, there's so many things that I don't know if this could be a little bit of a nucleus to start bringing these things together and putting numbers on stuff. And to another point, I think one thing we need to be careful about not doing is just saying, okay, here's our recommendations, eat more of this. You should be eating more of this, knowing that there's all these constraints and, we don't want to just cause more stress to women. Say, look, you're doing all these things, you're spending all your time doing this and that, but you know what? It's still not good enough. You still need to feed your child better. You need to do more. And that could just, leaving it like that could be just devastating. So again, I think we need to address these limitations by addressing the constraints. I don't know, I've probably used up my time.
Well, there were so many good questions, and it's a challenge to answer them in 2-3 minutes. Several of you raised, what about adolescents? What about men? Wonderful question. What about reproductive health? One of the strengths and one of the most serious weaknesses about the FES is its F for focused. And you make terrible choices at every question, every module. I can't answer that. I can't answer I don't know. I mean, don't we need to have a focused ethnographic study of men's views? Absolutely. And there are anthropologists and nutritionists who have been working in that area. I don't know that they have codified it in the same way that we've tried to codify the specific questions for the FES. So codified it in a fashion that is shareable. But it's certainly the answer is we got to know more about what's happening in these other areas, and somebody needs to take the lead to make it available in a fashion that you can use and make some comparisons with. Which brings me to Marcia's difficult and interesting question. Basically, how does it compare to what's out there? Strangely, your question is superbly timely. They always are, but this time is really remarkable because I'm just finishing another report for a different project I have with GAIN that you may or may not know about, and which is looking at SBCC or BCC practice around nutrition, and specifically around infant and young child nutrition. And she's absolutely right. There are a lot of different tools out there. In fact, it's extraordinary what's out there. I'll give you a little head start on the exciting findings from this project. Everybody thinks that their tool is the best ever. And when you ask people, what is it that your organization is doing that you're particularly pleased with, or not that you're pleased with, that you think is most important? Guess what organizations think is most important? It's promoting the use of their tool. Now, there are lots of other very, very good news findings from this study, which I'm hoping will get out soon. You know, it's the stereotypes about SBCC, BCC are just a thing of the past, and it's time for the nutrition community to wake up and get rid of its prejudices and stereotypes, and we're going to do the best we can on that score. But one of the things that we're calling for at the end of this review is somebody needs to sit down with all of these different tools and instruments and do some kind of a systematic analysis so that users have choices and can see which ones are more suited to them or how to combine them. So thank you, Marcia, for this opportunity to sort of get ahead of myself. But hopefully within the next few months that is also going to get out. Conflict between, one other thing, the conflict between work and care. But first, I just also want to say it's an exciting idea to think about modeling these other things in a systematic way. It needs to happen. A conflict between child care and work, a serious problem. Every woman knows it. I have a daughter-in-law who has a 12-day-old baby, and I can see this coming down the pike in spades for her. Family is dependent on her income, on what's going to happen when she doesn't go back to work in the barbaric society where you get 6 weeks off. So that whole issue is extremely it's very sensitive, it's very important. What has to happen is the women it's like there is no localized food system. There is no system in which many women are not out there already working. The problem is that they're not getting paid for their work. They're not getting paid enough for their work. And so it's issues not of promoting work, it's promoting work that will give them enough per unit of time that there's less conflict with childcare. Dream on.
Thank you. Bonnie, you get the last. Well, having not gathered the data, I think what I'd like to focus a little bit on is what GAIN will do next. There is an opportunity, and Jose, I think it's absolutely right. We can throw some of these observations back through the model and see what that gives in terms of, and contributes to the adequate diet. If you put more fish through, if you put, so how can we improve that recommendation with some of these ideas? There are 3 other FESs planned in the arid regions, FES OptiFood combinations in the arid regions of Kenya as part of a large project called Regal IR. So we're going into pastoralist communities to ask the same questions, combining the OptiFood methods with the FESs. And from GAIN's perspective, this exercise has been quite enlightening to debunk some myths, if nothing else. The extent to which mothers are sourcing IYCN foods from markets can't be emphasized enough. That's where they're getting the foods for the babies. And we need to look at opportunities to put more affordable, nutritious, complementary foods in the markets. That's where they're getting the foods. So from GAIN's perspective, it really helps guide us in the formulation of new products, the support of existing products, the support of the production systems that feed into those products. For example, it's great if we get everybody to just all of a sudden think that millet's important and 7 proportions of leafy greens per week, but does the ag production system support that? So there's all kinds of questions related to that. So there seem to be technological solutions that are coming out of this for our benefit. There are advocacy solutions, as Christine is pointing out. In Kenya in particular, there are real constraints in the marketing of complementary foods by law. This is really showing and emphasizing the importance of complementary foods in the diet and the need to bring in additional foods into that diet, particularly in these communities in particular. So there are all kinds of lessons for us going forward. And we will, as I said, take this same methodology into 2 other regions in Kenya in the next few weeks, actually. Right? You're getting on a plane very soon. At any rate, that's all. Thanks.
Well, thank you very much for coming, for sharing. Thank you very much to the participants as well. In terms of all of this massive amount of information you're going to make available, it would be really good, given how broad your findings are with the implications for the water community, for example, or the forestry or community, that they're also presented in such a form that you draw them in, so they find out that this exists, and this is actually something that they can carve for their purposes and make the contributions from their sectors. So thank you very much, everyone.